Good evening, ladies and gentlemen, and welcome to another edition of TBR. I'm George Binns, and this evening we're going to get into one of the more complicated things about the government service, TRICARE. And to help us understand it, we start with the local director of Veteran Services, Dave Perinchief. Welcome, Dave.
Thanks for having us again. So one of the main things that I always get is retirees who are trying to understand their healthcare system. Now, I'm not a retiree. I was wounded. I ended up getting processed out, so I only did my 9 years in the service. But for those who did, their full term, they are eligible for a benefit called TRICARE, which is a healthcare insurance plan. It's confusing. It has a lot of nuances. So today we're lucky enough we have an expert on the field, Mark Wasnock, retired senior chief, who is going to get into it for all of you to make sure you're getting the proper benefits and how the program works.
Oh, thank you. Thank you for having me here.
Well, thank you, Mark, for joining us.
Oh, I appreciate it.
So what is TRICARE?
TRICARE is just the word the Department of Defense uses for health insurance. If you ask the doctor if they take TRICARE, you're basically asking him if he takes health insurance.
Okay.
And I will say, when you mentioned the active duty, 20 years active duty, I never understood TRICARE. Actually, Champus days, and then went from Champus to TRICARE. Never understood it. It was off my plate, never had to deal with it. As soon as I retired, a year later, I was making my own TRICARE mistakes. So I understand where people are coming from and trying to use it.
Yeah.
But what I will also like to address is the three most important things people should know about TRICARE when they're using it or have it or run into problems. And it doesn't matter which TRICARE plan you're on. There's TRICARE Select, TRICARE Prime, the U.S. Family Health Plan, TRICARE for Life. The three important things, the first one being DEERS. DEERS is the Department of Defense database. It's a database.
Okay.
Defense eligibility enrollment reporting system. It's a database. It looks at your age, status, and zip code. Those can change while you're active duty. They can change while you're retired. If you're not in the database, you don't have TRICARE. If you move, even after you're retired, and if you don't update your address, it could affect your TRICARE plan that you're on. You could lose it. It could change. It's your starting point. So if you're using TRICARE and everything is running smoothly, and all of a sudden the provider says you don't have coverage anymore, that's a good starting point. You can log on to MilConnect, use your MyPay DFAST account, and you can look up your TRICARE benefits there. But it looks at your age, status, and zip code. So you need to keep that up to date.
Okay.
All right. The second thing people need to know about TRICARE, when they're under the age of 65, based on their age and zip code in the database, they may have some TRICARE options. You could have up to 3, sometimes 4 different plans. TRICARE Select, TRICARE Prime, U.S. Family Health Plan, Martin's Point, our sister company. You kind of have to figure out which one's best for your situation. People ask me all the time, which one's the best? Well, what's your situation? Do you have a doctor you have to keep? So I have to pull some information. I wouldn't say one is necessarily better than the other. It's just that we need to know what's important for you to use your health benefit.
So kind of like Blue Cross Blue Shield, premium, bronze, gold.
Yep.
Okay.
Yeah. So the Blue Cross Blue Shield, there's a PPO plan, there's an HMO plan. Same thing with TRICARE. Select is a PPO plan. Prime, U.S. Family Health Plan is an HMO plan. I can explain them all. I can direct you to which one is best for the situation. But you're going to have to kind of figure that out. That's what I do most of the time, is help people figure out which one is the best for the situation. The last thing, the most important thing people should know about their TRICARE benefit is they need to know who their TRICARE company is. There is not one TRICARE company. It's contracted out. There's in the United States, there's 6, 8, 9 TRICARE companies. So when you submit
These are private insurance companies that take a contract with the government to treat retired veterans.
Correct. Yes.
Okay.
Yep. They're DoD contracted insurance companies.
Yeah.
Okay. You need to, if you have a problem, a specific problem, you need to talk to your TRICARE company. All right. All right. So that's why it's important to know who their TRICARE company is. Those are 3 things: DEERS, choices, who's your company.
Chris, would you put up the chart with who's eligible for this stuff? I was amazed at the number of categories of different people that are eligible for TRICARE. And I guess you're the wizard on this and understand it. Is this automatically happen, or does somebody have to say, hey, I just retired, please sign me up, or have to fill out something? Or how does this get started?
Well, I wouldn't necessarily say it's automatic, okay? But it needs to be added to that DEERS database.
Yeah.
Some things, when you go active duty, some things are automated when you go active duty just by the virtue of getting those orders. But like children, a birth of a child, the Department of Defense doesn't know you have a child until you take that birth certificate and put it into the database.
Okay.
So it's that database is what
So even though
creates that
you're on active
eligibility.
duty at a military base with wife and family, and wife gives birth in a military hospital, it still doesn't show up in the system?
Well, for the spouse, hopefully the spouse is already in the system by getting that military ID card. But that child, no, not until you actually enter them into the database.
So even though it's in the military hospital,
Correct.
the database doesn't know anything about it?
Correct.
So that's your responsibility to do that?
Yeah,
Okay.
it's always your responsibility to make sure your DEERS information is correct.
Yeah.
Correct. Yeah.
So if somebody's got a question, Chris, would you put up the contact information, please? That's the best way to start, I guess.
Yeah, that's my email address. You can certainly reach out to me or call me. The good thing about the company I work for, I'm with the TRICARE company called U.S. Family Health Plan. I'm a remote employee. I travel around. I don't have to sit behind a desk. I do stuff on Hanscom Air Force Base. I go to people to answer their questions if they want to do face-to-face.
Yeah.
They can also call me, Zoom meetings, meet with people anyway.
Yeah, possibly, definitely was talking with Mark, maybe we do a seminar down here. If we get enough retirees in the region, we'll just kind of have an event so questions can be answered in person, on site, and then I can also bounce off of what VA options we have and then state options. We were discussing earlier, so maybe we should talk about understanding the VA and the comparison to TRICARE.
Right.
Well, that gets to be the other thing, because I get VA medical coverage for just my service. I didn't retire. I just was discharged. And I guess there's various grades of what kind of service you get depending upon how long you were in. And
So the VA healthcare system is broken down into priority groups. Your priority groups are based off of your disability percentage. Your disability percentage opens up more doors. But what we want to focus on is how the retirees' TRICARE affects their VA disability and what is covered, how it's covered. So
you were talking before the show that there's more coverage available depending upon your particular circumstance.
yes.
So what are these other variables that get you into different things?
Well, the thing I'd like to point out that VA and TRICARE are completely separate programs, and one does not impact the other. So someone that is retired from the military may and is probably eligible for the VA, but someone that is separated or did their 4 years in the military and got out, they may be eligible for the VA. They're not eligible for TRICARE. So TRICARE comes strictly out of the Department of Defense's budget. The VA is a government program, but it's not part of the Department of Defense's budget. So you could have both potentially, but don't confuse the two. One, they're not the same thing. I use both. I use both VA and TRICARE. I mix and match depending on what I want to get done.
So here's an example. So let's say you're a 20% service-connected veteran, and that qualifies you for coverage for, let's say you had a major ankle injury.
Yeah.
The VA is like 20% your ankle. That's the only thing the VA is going to cover for you. So if you go into a VA hospital and say my ankle's giving me trouble, and they say we got to do surgery on your ankle, because that's service-connected, they will take care of that. But now, if you have TRICARE and you're a retiree with that ankle injury and you go in for a shoulder, TRICARE is getting the bill, and you're getting the bill.
What do you mean you're getting the bill? Is it percent?
Because you have to think of the VA like a regular hospital.
Yeah.
They provide care. The only benefit is that disabilities related to service are covered. If you're a retiree and you have health insurance, like I have private health insurance, if I went to the VA for something that's not related to my service, they would bill me like a regular hospital and a regular checkup.
Yeah.
So that's to understand. Even retirees, if they don't meet that disability percentage threshold, and the VA will take their TRICARE or whichever
on the plan.
whichever plan they utilize, but they will have a copay. They will have responsibilities to that bill.
So it's just like Medicare, that the government picks up a certain percent of it, and you get a copay charge for the difference.
It could be, but again, it all depends on what you're being seen for, because they're looking at service-connected disabilities and what your percentage levels are. If you're trying to compare the two, you know, if you're 50% or higher at the VA, anything you do at the VA is free. You don't have to worry about it. But with that said, they're going to still ask you other health insurance. It's still a business. If they can pass the bill off to the Department of Defense, they might try.
Yeah.
So yeah, it can be complicated. But what I would just say is, you know, keep the VA and TRICARE separate. They're separate entities. You could be eligible for benefits for both, but one does not tie into the other. They're completely separate.
So it's like two separate companies.
Exactly.
Exactly.
Two separate government entities. Yeah.
The government is eventually financing them, but as you pointed out earlier, it's subcontracted to an independent private company
Yes.
that actually manages the paperwork and passes the money around.
Yeah. So basically, you know, the Department of Defense, their mission is not really healthcare,
True.
right? So they outsource it.
Yep.
And they hire TRICARE contractors, companies, to administer health plans.
Yeah.
In the civilian world, they call them HMOs and PPOs, and that's what they do in the Department of Defense. It's just they call it Select and Prime.
Okay.
So, yeah.
So if we had a situation like you started with, got an ankle injury, service-related, the tank ran over your foot or something, and you got problems later on, and you go to a VA hospital, and they find out, oh yeah, this is service-related. They pick up the whole tab?
Correct.
Okay. Now, if you walk in there and said, hey, I sprained my ankle playing softball, they will probably treat you also,
Yes. So
but they will charge somebody else or try to charge somebody else.
correct. So this is where you, again, as Mark was saying, is you have to understand that they're two separate entities. So the VA is only responsible to care for a veteran based off of their percentage and the disabilities caused by service.
Yeah,
So for retirees especially, let's say you have a National Guard retiree.
yeah,
Now the retirees from National Guard are eligible for TRICARE, correct?
yeah.
Yes, normally at age 60, unless
Okay.
they were medically retired on duty.
Yeah. So let's say you did your National Guard, you retired, age 60 hits, you're like, okay, I've got my TRICARE plan. I want to use the VA hospital. You go into the VA hospital, you get your primary care set up. Because you have no service-connected disabilities, you're not going to have a priority group that's covering anything. So they're going to contact whichever agency falls under TRICARE, and you will get a bill.
Yeah,
Pretty straightforward?
Oh, yeah.
yeah, okay.
The only thing I'll add on that is depending on which TRICARE plan that 60-year-old National Guard picks. So at age 60 in this area, they could either have TRICARE Select, TRICARE Prime, or the TRICARE Program US Army Health Plan, and they all play a little bit different as a payer to the VA. So
Well,
that
that's the
gives you a
same
little
as
bit of, right.
the PPOs and the
Exactly.
that you
Exactly.
that you struggle with the civilians.
Yes,
Yeah.
100%.
Yeah.
So how does someone find out what provider through TRICARE they have?
Well, first you need to know which TRICARE plan they're on.
Okay.
Now, if they're on TRICARE Select, that's a PPO. You don't even have to designate a primary care doctor. You're managing everything yourself.
Okay.
You can go see any specialist, any primary care doctor. You don't need referrals. You're just going to pay more out of pocket when you use it.
Yeah.
TRICARE Prime and US Family Health Plan are HMO versions. So you do have a primary care doctor, and the companies implement it a little bit different. Like US Family Health Plan, we don't assign you a primary care doctor. You pick one from our network. If you already have one, a primary care doctor that's in our network, you get to keep them.
Yeah.
TRICARE Prime, it's a little bit different. Humana military does a little bit different, and sometimes it depends if you're active duty living on a base or out in town, how far you are to the base. Sometimes they'll assign you a primary care doctor at a military treatment facility.
Yeah.
Sometimes they'll assign you to a provider out in town. So you need to first know which plan are you on. Are you using a network or not? And then you want to, if you don't know who your primary care doctor is, you need to contact your TRICARE company and ask them, do I already have a primary care doctor? And go that route.
Well, the reason I bring this up, I ran into some guys at the Y who were Coast Guard stationed out in Gloucester, and they were talking about TRICARE coverage for themselves and their families. Well, because the Coast Guard doesn't have the equivalent to a VA hospital or a base hospital. So how does that work for somebody's on active duty like that?
Well, if they're on active duty, their sponsor is assigned. They're part of the government. They're assigned to the government. They tell them where to go and who to see. It's kind of off their plate. It's managed for them.
Yeah.
Family members have a little bit of a different story. For an active duty family member, they can still choose TRICARE Select, TRICARE Prime, or U.S. Family Health Plan. So depending, again, which plan a family member is on, it depends on which plan they're using through which company. Some of them they can manage themselves. Some of them they might have an assigned primary care doctor.
Yeah. Now, these primary care doctors, are they part of the VA system, or are they
No.
just a local doctor?
If he accepts the program that TRICARE falls under.
Yeah, so TRICARE Prime through Humana Military is an HMO.
Yeah,
They establish the network. They decide.
yeah,
They reach out to providers, say, hey, do you want to be on this managed plan and accept the reimbursement rate?
yeah,
So the doctor has the ultimate say, yes or no.
Yeah.
They also have military hospitals and doctors. Okay, U.S. Family Health Plan is completely 100% civilian based. There's no military doctors in the U.S. Family Health Plan organization. So it's to say they're all civilian. The only limitation is, are they accepting new patients or not?
yeah.
Okay.
So this gets complicated, because I'm thinking through my own situation where,
Yeah. Again, got to keep VA and
Yeah.
TRICARE separate.
yeah,
Separate
and
program.
You and I have played this game before where I'm finding out I got Medicare and VA coverage, and when I go to the VA hospital, next thing I know, I get a notice from Medicare that they just got charged so much, and it gets to be a morass. But so I guess it really comes down to, we need wizards like you two to help to explain how this system works, and maybe, like you said, need a seminar for anybody that's interested.
I would add to that is that you can't put everyone necessarily into the same TRICARE boat. So people's situations are different.
Yeah.
And that's where Select comes into play, Prime comes into play, and U.S. Family Health Plan comes into play. So it's important for me to find out is what their needs are. Do they need to see Dr. Smith? Does their kids have to see a certain specialist at Boston Children's Hospital? You know, so those pieces will determine which TRICARE plan is best for the situation. All right.
So that's really what you're doing, is sorting through this morass of obligations that a parent has and trying to figure out what is the best way to get the best coverage possible. And I assume by best coverage means they get to see the right kind of doctor at the right facility, and at the same time minimize their out-of-pocket costs.
A good example I can give you related to that. So we get all the time, we have active duty families all over the country. I get people calling me from Japan and Germany. Their college student is going to a school in Boston.
Yeah.
They're active duty, so they're on a prime program because they're active duty. They get assigned to Hanscom Air Force Base. Well, it's pretty hard to get from Boston to Hanscom Air Force Base without a car.
Yeah,
So they're having a problem managing their health care.
yeah,
They don't know that USB Health Plan might be an option. They get a doctor right there close to where they're living.
Boston is full
Because
of
they don't know.
doctors, yeah.
You know, that's it. They don't know.
yeah.
So getting that information out to people Yes. that
So they
is
can
very
make the
important.
change and say,
Right.
whatever you plan you had me on to send me to Hanscom, you can have a
Yeah.
local doctor in Boston.
I would say a lot of the people I talk to think TRICARE is just one entity, one
Yeah.
thing.
Yeah.
But it's not. It breaks down into different programs and different companies. So that's what we need to find out.
Maybe we should cover about widows or the dependents after the veteran dies.
Yep.
Oh,
So
well, that
this-
was the other part of that long list is even divorced spouses are covered.
In some situations. That's the divorce spouse. It's on the TRICARE.mil website. It's called the 20-20-20 rule, where they had to be married 20 years. They had to have 20 years of credible service, and those 20 years all have to overlap. So if they get divorced and they meet the rules of the 20-20-20 rule, then the former spouse can keep TRICARE as their own sponsor. They become their own sponsorship.
Okay.
If they don't meet those rules, there's a version of that. It's 20. I think it's 15, 15, and 15, but you only get to keep it for 5 years. But if you just got married, my ex-wife, we were married 6 years. She didn't get any TRICARE.
Okay.
So it really depends on the length of marriage and the overlap to the military.
And this was a
service.
protective measure. There was a few news articles about 7 to 10 years ago about how there was a woman who was marrying service members in order to obtain the benefits. So this just highlighted the importance of, so if you're at your last year of military service and then you get married, she's not going to meet that 20-20-20 rule
Yeah.
if you get divorced 2 years later,
Yeah.
even though you are a retiree. And this was due to predatory practices
Right.
against men and women in the service.
Okay.
So-
And that's a good segue to if the sponsor dies. So
Yeah.
if in that scenario, if someone got married that last year of active duty, or even if they got married a year after he retired, if the retired military sponsor dies before the spouse gets to keep TRICARE the rest of their lives unless they remarry.
Yeah.
So I always tell them you got to live in sin after that if you want to keep your TRICARE benefit. So.
This is mind-boggling. All these little nuances of
Yeah.
if they do this, if they don't do that, and
Well, the TRICARE website, www.tricare.mil, it is a good website. It's got loads of information. It can be sometimes daunting to try to navigate it through there, but you will find the answer on there.
Yeah.
Sometimes you get the answer, it's still maybe. Maybe yes, maybe. That, call me. I'll tell you, I'll explain it, where you fit in on that maybe.
well, are you the only guy that does this, or is there so?
No, there's more. So we have some actually more U.S. Family Health Plan reps in the area. We have one that covers Southern Massachusetts, the Cape, and Rhode Island. Covers one that covers Western Massachusetts. And then Humana Military, they have some TRICARE reps like me, but they just go out and do presentations when they're asked. They don't necessarily go out and educate, like we're doing here
Yeah.
today.
Yeah.
So there is other people out there. What I would say, though, if you have questions related on your TRICARE eligibility, stuff related to that database, don't call the TRICARE companies, the member services, because they're trained to do the claims. They're trained how to file claims, referrals. Excuse me. A lot of times they don't know how the database ties in. So you might get some confusing answers there when you're trying to get eligibility questions answered through a contract.
Or you just might get the wrong answer altogether.
It's possible, yeah.
Yeah.
So
So you've got an office where Hanscom still, or
I have a space on Hanscom that I do seminars. I currently do it at the Minuteman Commons. And I book them out every couple of months. I'm trying to find permanent location on Hanscom again,
Yeah.
where I can have actually set days that I'm there. That's been a little bit of a challenge. But I'm considered a remote employee, so a lot of times I work out of home.
okay.
But I meet people at Dunkin' Donuts. I met a person in Scituate a couple weeks ago at their house. just to
Okay.
go over it with him. He was,
Oh, you make house calls.
I'll make house calls.
Yeah.
Just give me some coffee, black. That's the way I drink it.
Yeah.
But yeah, so
So-
I'm mobile.
So you can be reached through your website.
Yeah, on our website, the usmail.org, my contact information is on there
Yeah.
as well.
And then,
I'll have cards at my office if people are, want to just, they can't. Again, some people are not computer savvy, so feel free to call my office. We'll relay the information.
yeah. And I noticed you got a whole bunch of brochures you're going to leave with us.
Yeah.
So we can get through this whole mess, I guess. You really need to contact somebody who, like you and you, who really know what the system is about, or at least know. One of the things that always impressed me that first meeting we had, you pick up your phone and you call somebody, you get an answer right away.
Yeah.
And the ability to find the right people so that you know who to call so that you're going to get the right answer as opposed to blindly typing into Google.
Right. Yeah.
Well, this is part of the job of the VSOs is to develop these contacts and develop these resources that the state wants us to have,
Yeah.
which benefits the citizens of each town. Mark was referred to me through Kim Emerling from Salem. So I would mention I was looking for someone who can really break this down and get into the details of it, not just a blanket answer, but will come here, talk,
Yeah.
explain the information, and then be a resource for people to reach out to.
Yeah.
That's the whole point, because I much prefer talking to a person than the machine or going on Google,
Yeah.
because then at least, again, I'm not an expert in TRICARE, so when people call me, it's like, give me a few minutes, let me reach out to someone, I'll relay the information so that he can then
Yeah.
call back over.
Well, that's half the battle. It's just getting to the right person or the right resource.
Just like the VA, a good VSO is worth their weight in gold. Trying to navigate the VA is the same way.
Yeah.
Yeah.
Well,
Yeah.
I don't
You
know
all
if
right?
we're
You seem a little overwhelmed.
It is. You guys talk this stuff like you live it every day. And I can imagine some guy who just got retired or has been retired a couple of years, and he's trying to figure out what's this bill about. I went through that once with you, and trying to unravel this thing.
One of the big things that retirees and their spouses need to understand is that after 20 years of a specific mindset and way of doing things and being handled, it takes a while to break from that habit.
Yeah.
Military lifestyles, it happens to police, it happens to fire, it happens to nurses, it happens to doctors, anybody within these high intensity, high stress, highly regulated, SOP style jobs.
Yeah.
Once they step away from that, it's almost a culture shock.
Yeah.
And you have to go from being told, okay, you're going to do this, to good luck.
Yeah. Well, thanks again for joining us this evening, and we've got your address, so hopefully people have got a question, they know who to call and what to ask about.
Yep, and we'll have the materials that Mark's going to leave with me, so that'll be at my office. That's just pop in, grab it when you want it.
Yep.
Well, I'll make a scan, so if people want to email, they'll just email it over to them. So I do plan on putting this onto the city's website once I get with IT, and so at least be on there also.
Okay. Well, ladies and gentlemen, thank you for joining us this evening. If you got any questions, don't ask me, ask them. And we'll see you next time.